So first, what late talking is. There's a lot of different definitions for late talking, but one of the most accepted ones is where for a receptive language, or the language we take in, we're at pretty normal. So they're able to understand like simple directions, they're following along with, if you're saying, oh, where's the ball? They're able to kind of look around a little bit. But what they're having trouble with is more of being able to make some of those requests, use some of those words, and not using as many words as we'd expect around their age. So for instance, at 2 years of age, we're expecting about 50 words is kind of that standard, and some emerging like 2-word phrases. And for a lot of late talkers, we might have no words or only a handful of words. And so when we're seeing some of that, that's when we fall a little bit in that late talking category. So we actually don't have a set cause of late talking. There can be underlying concerns, but at the same time, there can just be some risk factors that lead to it. Risk factors include things like if they're in a low birth weight, premature, a lot of the times we'll see the kind of later development of some of those milestones. Other things we have are if they have an older sibling, sometimes that causes a little bit of late talking because a sibling will kind of talk for them or talk over them a little bit so they don't have to rely on their speech as much. And then also family history. So if the parents or someone close to the parents has a history of late talking, the child is more likely to have late talking. It's just a little bit of like a genetic link, but there's no specific one cause for late talking. About, I think 50 to 70% of late talkers do catch up by preschool and the school age years. But when they were doing testing, research has found that even though they were testing kind of in the average range, it was on the low average range. So they are technically within normal limits, but they're having a bunch of ongoing factors that they're falling a little bit behind in their peers. So they're talking, but they're having lower like literacy scores. They're not storytelling to the same extent. They're sometimes having more difficulty with like specific vocabulary skills. So they're talking, but they're not using as many kind of unique words in their utterances, unique phrases and sentences. And then sometimes they have like grammar differences. So you might have just some sentences that are a little bit off too. So even though they're technically catching up, it's not always at the same extent as those who were not late talkers. Depending on kind of that age, if we're at that 12 months and we haven't seen babbling, we're not getting kind of some of those emerging words, that's where we'd be a little bit concerned. If they're not like making that eye contact, if they're not doing some of those early social things, that might be kind of an area of concern where there might be more underlying things that we want to kind of address for those foundational communication skills. Also gestures. Gestures are a really big cue for if we're going to develop some of that language or if we might need some support. So a really good example is like, are we waving? Or even if we're pointing. Because if you think about a point, it's a really good communication skill. Rather than just them crying and looking at something, they're showing you exactly what they want. So if they're not making more of those specific gestures, that also might be kind of an area of concern by that age. If you're noticing that they really seem like they want to communicate, but they can't communicate, and you're seeing those break down more, that might just mean they need a little bit of extra help in their communication. So we use a lot of play. And the reason for this is play is really getting at the child's level and their area of interest. And so we're trying to find the things that they're interacting with and continually build on that. So for instance, say a kid really likes dropping a ball and they just like to watch the ball fall. We're going to use that and we're going to use it for language opportunity. Another thing I recommend to parents a lot is also called self-talk and parallel talk. So that's talking when a parent is getting ready with them in their daily routines, talking about what they're doing. So for instance, if they're putting on shoes, I might say, okay, let's find some simple phrases to use over and over again, like 1 foot, 2 feet, or like shoes on, shoes off. You might see, so within those strategies, different types of supports too. Like for when a kid starts speech therapy, I might be using a bunch of models. So anytime they need say more, I'm going to say, oh, more, I want more, and then hand them an item. Versus if I've seen them kind of try that more before, what I might do is pause and go, oh, you want?
Okay.
And then, so I'm
you're
adjusting
constantly
the
tweaking.
cueing and tweaking it. But those are the foundational strategies I use, but there is a level of support that is adjusted as we go to, just based off of their response.
Okay.
The last resource I have too that I always like to recommend is the American Speech and Hearing Association has developmental norms for speech and language. They have these beautiful handouts that parents can find too if they have any questions of like where they should be. Those are what I tend to recommend to look at.
Okay, perfect. And if a parent is overwhelmed, can they also just call and you could send that to them as well?
Absolutely.
Okay, perfect.
Absolutely.